Hey guys.
Hey.
There we go. All right, so I looked into Realize It to just see how people were doing so far, and most people were doing pretty good, but there's some people who haven't got into it yet, and there was a couple of people who were having trouble with certain things. So I thought we'd just go over this chapter 2 together with this PowerPoint, and we'll see if that helps anyone a little bit. Vera emailed me and asked me if I could put the other PowerPoints up for you guys just to have them so you could take notes from them or something. That's fine. I can try and do that. I may not put them all up at one time, but I'll get to it eventually here. So we can do that. I was going to ask you guys, do you have access to the student resources for your book? Like, can you go into Evolve for this particular book and get into student resources?
I know we can get into Evolve. I don't know what you mean by teaching resources.
Well, it's not teaching resources, it's student resources. Here, let me show you what I'm talking about. You may not be able to do this, but I was hoping that maybe you could, because it would probably be really nice if you could get in here. Hold on, let me share my screen. Okay, so I have like 3 million books on here, right? But here's this book. So the thing is, for me as an instructor, like I have more access than you guys do, of course, but for me as an instructor, if I wanted to set up a class, like I have to have this course ID like this one has here, and like we do for our lab stuff, but not everything that I have has that. So I can't like invite you guys to give you access. Sometimes when you have book access, like if you have an actual physical book, it'll give you a code in the front of it to be able to get into some of these extra resources that they have. So like, I don't know, if you just have an ebook, you may not be able to do this, but like when you get in here to this book, you see how it says instructor resources, student resources. There's all kinds of stuff in here. So like every chapter, like say we're doing this chapter 2, every chapter has certain things, so there's review questions and like, look at this key points. So it just like summarizes all the important stuff of the chapter. See? So anyway, I didn't know if you guys had that or not. I just thought I'd mention it just in case you could get in, because it is kind of nice. There's a lot of stuff in there that might be helpful to you. Okay, so we're going to go over this real quick and see what you guys think about this chapter. So we've talked about culturally competent care before a little bit, and some of this stuff we've kind of talked about before in other classes. But basically, when we talk about someone's health status, we are looking at certain things that make up their health, right? So for individuals, we're talking about the sum of all of their current health problems plus their coping resources. So what do they have to help them cope? Factors in a person's social and physical environment would also play a part here. So this would be like your relationships with others. You know, if you have a lot of good relationships with people, you're better able to cope with things that might be going on with your health. Your workplace, your housing, your transportation. If you live in a neighborhood that has a lot of violence or something like that. All of these things contribute to your health status. So we need to look at all of those things when we're looking at how healthy someone is. When we talk about community, this would be a little bit different. You kind of look at it the same way, but a little bit different. So with community, you would be looking at things like birth rates and death rates, life expectancy, access to health care, morbidity and mortality rates due to disease and injury. So like, you know, maybe I'm talking like COVID-19, you know, what's the morbidity and mortality rates for Summit County, you know, so stuff like that. And then this also talks about the availability of health care with the Affordable Care Act. So when that Affordable Care Act came about, it reduced the number of uninsured Americans by like 5.4 million in that first year. However, a lot of people still remain uninsured and have limited access to care, which impacts both individual and community health. So it's something that you know, people are trying to look at to see what they can do about it to fix. Okay, and then when we talk about health disparities are differences in the incidence, prevalence, mortality, and burden of diseases that exist among specific populations in the United States. Health equity. I don't know if you've ever heard that term before, but health equity just means it's when every person has the opportunity to attain his or her potential and no one is at a disadvantage. So this also mentions ethnicity and race on this slide. So these are both kind of subjective terms and they're based on self-report. Like someone might say, hey, I am Caucasian, or I'm, you know, whatever, like, you know, when you're doing the census or whatever. So despite improvements in treatments to prolong life and improve quality of life for most individuals, racial and ethnic minorities have benefited far less from these advances. Okay, so when we talk about these health disparities, so there's differences in access to healthcare services. So like say you live way out in the country somewhere, you know, among the frontier or the rural areas. You may have a hard time getting to the doctor or finding someone to go to because there's not as many healthcare providers out there. Also, people of lower income, education, or occupational status also experience worse health and die at a younger age than those who are more well off. Healthcare costs are also a big factor that contribute to health disparities. So if it costs too much to go to the doctor for something, then sometimes people just don't go because they can't afford it. Do you guys, I think we talked about health literacy before, didn't we, in one of our other classes? Do you guys remember what that is?
I remember we talked about it, but I don't exactly remember the definition of it.
Okay. So what it is it's the degree to which someone has the capacity to process and understand basic health information. So if they can understand basic health information, then they can make appropriate decisions about their health care. So if someone has high health literacy, that means they can understand, the basics about what someone's trying to tell them about healthcare, and then they can make an informed decision about it then. So unfortunately, there's a lot of people out there that have really low health literacy. So when people try to educate people about a certain condition, sometimes they talk way over their head, or they just don't have that understanding. You need to talk down a little bit to them so that they can, comprehend what you're trying to say. So there's also health disparities that exist between men and women. So adult women actually use healthcare services more than men do. Women may not receive the same quality of care though. So when gender is combined with racial and ethnic differences, the disparities are even greater. Oh, and on this slide, it also mentions sexual orientation. How do you think that affects access to care? Do you remember last term when we had some kind of conversation about like transgender and people like that, and how a lot of doctors don't have that knowledge about how to take care of someone like that? And there's a lot of people that have, like biases and things against people like that, and they treat them really horribly. So I think there is a big health disparity in sexual orientation. So if you say that you're, bisexual, or you say that you're transgender or whatever, there's a lot of things out there that prevent people from getting actually good care because of that. Okay, this also talks about other things that can lead to health disparities. So your attitudes, a healthcare provider attitude. So certain behaviors and biases of healthcare providers can contribute to these. So your bias or your prejudice can affect healthcare seeking behaviors in minorities. Even well-intentioned providers who try to eliminate bias in their care can demonstrate their prior beliefs or prejudices through how they communicate non-verbally. So discrimination can result in the delay of proper diagnosis due to assumptions made about a patient. So a lot of times we assume certain things, and we can cause a big problem by doing that.
Yeah, and I think I read somewhere, I think on Realize It, where it says that men are actually given the tendency to undergo procedures more than women, especially when it comes to like cardiac procedures or something like that.
Yeah, it's probably true, which it's sad to think about that in this day and age,
Mm-hmm.
that it's like that, But yeah, that's
Yeah.
definitely true. Okay, then this gets into a little bit about culture. So remember, our culture is just our knowledge, our values, our beliefs, our customs, our habits that we do. It's a way of life for a group of people. So our values are sets of rules by which we live by, right? So cultural beliefs about symptom tolerance and healthcare seeking behaviors can also contribute to health disparities. For instance, in some cultures, pain is considered something to be endured or ignored. And as a result, the patient may not seek help because of that. Also, some cultures attribute the sign and symptoms of illness as God's will or a punishment for some kind of bad behavior they did in the past. Can you guys think of a culture that thinks that way?
Don't the Native Americans think that way?
I don't know, they may. I was thinking more like Asian Americans. I think Asian Americans have that belief a lot that, maybe they're getting punished for something they did in the past or whatever.
Oh, kind of so like the hot and cold kind of.
Yeah, yeah, yeah. hmm Okay, so this slide here is talking about characteristics of culture. So here's some basic characteristics. So we've got dynamic and it's ever changing, not always shared by all members of a cultural group. So meaning that if you're part of a cultural group, you may have different, ideas and things. It's adapted to specific conditions like environmental factors. And then it's learned through oral and written histories as well as socialization. Okay, in this picture, it's just showing, family roles and relationships differ from one culture to another. So like this older lady here, she's dressed in her normal, like her cultural type of dress, right? But then this may be her daughter and her granddaughter or something, and they're totally more like, like today's dress, like we all dress here in the United States. So this word acculturation. So this means it's a lifelong process of incorporating cultural aspects of the context in which a person grows, lives, works, and ages. The context also changes as it's influenced by a person's culture. For example, behaviors change when an immigrant child learns the local language, while also influencing the conduct of classmates. Exposure to new cultural contexts also increases the cultural competency of nurses. So it's a good thing for us to be able to acculturate to other beliefs and cultures. So we, if we have that knowledge, we're able to give more culturally competent care to people. So that's a good thing. All right, and this is just kind of a lot of definition type stuff here on this slide. So stereotyping is just an overgeneralized viewpoint that members of a specific culture, race, or ethnic group are alike and share the same values and beliefs, and does not take into account that individual differences exist within a culture. So you may, generalize like some kind of statement to all kinds of people of one culture, but that's not necessarily the case. Ethnocentrism. This refers to the belief that one's own culture and worldview are superior to those of other different cultural, ethnic, or racial backgrounds. So think about like World War II era. You remember back when Hitler and all of that was going on. So Hitler was like that. He had ethnocentrism. He thought that his race was better than any other race out there. And so that's why he did all those horrible things. Cultural imposition. This occurs when one's own cultural beliefs and practices are imposed on another person, group of people. This can result in disregarding or trivializing a patient's healthcare beliefs or practices. So if you push your own cultural beliefs on someone, then that can hinder what they believe and what they want to do. So healthcare providers need to remain open to various perspectives and maintain a non-judgmental view of values, beliefs, and practices of others. The goal of transcultural nursing, which was Madeline Leninger's, focus of her study, is the discovery of culturally relevant facts that can guide the nurse in providing culturally appropriate care. So when we talk about cultural competence, again, this is just our ability to be able to appreciate other people's cultures. So to not, stereotype or, have a bias against something that they're doing and thinking that it's stupid, but everyone has some type of value for what their belief is about, you know? And if we value everyone else's thinking and like, maybe we can get more accomplished with that patient if we give this type of care. So we need to have cultural awareness, cultural knowledge, cultural skill, and then they talk about cultural encounter here too. All right, so this is just saying interprofessional teams work together in a multicultural healthcare environment. So you have to learn to work with others to be able to give, you know, really good culturally competent care. So over time, as you get out into the workplace and stuff, you'll work with all kinds of different people from different backgrounds and different views. And you need to be able to work with them and still appreciate each other's views, because sometimes it takes a bunch of different people with different ideas to come up with a solution for something. That's like today in healthcare, you know, they say, like in my doctorate stuff that I'm doing, they constantly are talking about this, about how it's really important to collaborate with others. And even though you may not believe the same that they do about something, to come up with compromises and to look at things in a different light to be able to come to a solution on something. So that's super important. Okay, so cultural factors affecting health and healthcare. So a lot of times, you know, people will have some different views on things. Like maybe someone will want a folk healer to come in to try and, you know, make them feel better. So maybe you don't think that's anything. You think that's a crazy thought to do something like that. But if you were giving culturally competent care, you would agree to this. You would have this person come in because it's not going to hurt anything, but it's going to make this person feel better. Many cultures have, you know, a lot of other things that they do as well. So we just have to, you know, be open to what they're thinking. Spirituality and religion may affect a person's belief about health, illness, and end-of-life care as well. You can use several interventions to meet a patient's spiritual needs, including prayer, scripture, reading, listening, and also referral to other people that they may want to see. Cross-cultural communication refers to an organized pattern system of behavior that may be verbal or nonverbal. So verbal communication includes one's language or dialect, as well as their voice, their tone, and their volume as they're sharing their thoughts and feelings. Nonverbal communication could be gestures, body movements, posture, your facial expression, your eye contact, use of touch, all of that kind of stuff, spatial distancing. And then silence has many meanings, and it's important to understand the meaning of silence for different cultural groups. Some people are comfortable with silence, whereas other people become uncomfortable and may speak to decrease the silent times. Okay, so family roles and relationships are very important. They can affect the health of the individual that you're trying to deal with. So it's important for you to assess the roles and relationships in the family of the patient. Determine who should be involved in communication and decision-making regarding the health care of that person. In some cultural groups, there is an emphasis on interdependence rather than independence. So a lot of times it's like multiple people in the family making the decision for that person. All right, and then this is a thing about personal space zones. It's kind of funny seeing as how we have that social distancing going on right now. But anyway, with this personal space zones, it says these are variable and subjective, at which one person feels comfortable talking to another, right? So personal space distances vary from culture to culture as well as within a culture. As a nurse, you often interact with patients in intimate or personal zones, which might be uncomfortable for the patient. So in this slide here, it talks about intimate. So intimate means that you're, you know, within 18 inches from this person. So people emotionally close to you enter into this zone. So typically our family's more someone we'd be that close with. Personal ranges from 18 inches to 4 feet apart. Distance, you stand during a friendly gathering. So maybe you're talking to a friend of yours or something. Maybe that's the distance away that you would be from them. Social, this ranges from 4 to 12 feet. So that's kind of like what we're doing now with the social distancing. So the distance you stand from people who you don't know very well. And then public, this ranges from 12 feet or more apart. So this is the distance you feel comfortable with when addressing a big group of people. All right, this also addresses things like touch, food and nutrition, and immigrants. All of these things can affect our health. So physical contact is like super important. But if you are unsure if that person, from another culture likes that or is okay with that, you need to ask. You need to ask permission before you touch them. With food, this is an important part of cultural practices. So you want to include foods that this person eats on a normal basis, and you don't want to just continue sending them things that they don't like or they won't touch. So ask them about their rituals and things and what they like to eat. Recent immigrants may be at risk for physical and mental health problems for many reasons. Conditions in their countries of origin may have resulted in chronic health problems. In addition, relocation is associated with many losses and can cause economic hardship. Also, physical stress and mental distress. This is just a picture of some people who must have been supposedly immigrants that joined a neighborhood barbecue. All right, also medications and psychological factors can affect healthcare as well. Some medications are more effective in certain ethnic groups than others, whereas side effects may also vary among individuals from diverse backgrounds. You need to be aware that many people use both cultural remedies and prescription drugs. So that's something that we need to be specific and ask about to people of other cultures to make sure that we're all on the same page about what's being done. It's important to develop a collaborative, trusting relationship with patients and encourage them to discuss their traditional approaches to healing. Seek out information on potential drug and herbal product interactions from the pharmacist. In regards to psychologic factors, symptoms are interpreted through a person's cultural norms and may vary from recognized interpretations of Western medicine. Can you guys think, I don't know if you talked about this in pharm or not, but can you think of any specific medicines that like they work differently in certain cultural groups?
Personally, I think amoxicillin.
Okay.
Chloroquine is mainly for malaria.
Right.
From the part that I'm from.
Mm-hmm.
Um,
I vaguely remember back from when I had farmed forever ago, I remember talking about a certain medication that if you give it to a certain cultural group, they don't do well with it. And for the life of me, I can't think of which medication it is now. I keep wanting to think it's Coumadin, but I don't think it's Coumadin. But
is it codeine?
like maybe.
Because I know that. Go ahead, Stella.
Would it be like beta blockers with African Americans?
I don't think that's the one I was thinking of, but I keep thinking it was something like someone from. I'll have to look that up and tell you guys another time. I can't think of it right now. I keep thinking it was something like someone from like Asian descent or something. Like if they took this certain medicine, it didn't work as well with them or something. Okay, we'll just go on. I can't think of that right now. All right, so with this slide, it's talking about your nurse's self-assessment and the patient assessment. So you first want to assess your own cultural background, your values, and your beliefs related to your health and healthcare. Cultural competence is a lifelong process that involves self-reflection and continual learning. So you always want to do that. You always want to look back on your own beliefs and make sure that you're treating someone fairly. Next, do a cultural assessment of the patient to determine the patient's health beliefs and their healthcare practices. Use a medical interpreter if you do not speak the patient's language. So that's super important. So you can serve as an advocate in finding and evaluating information on appropriate and individualized treatment and in navigating the healthcare system. You can be an advocate in your healthcare setting by helping to create a community advisory group to help establish health programs and increase the distribution of culturally sensitive information. It's really important. This is like a huge issue out there. If you think about it, I don't know the last time any of you have been to the hospital for anything where you actually had to get admitted or anything like that. But in the hospital setting, you don't really have a whole lot of culturally specific things for different groups of people at the hospital. Like I remember years ago, we used to always have to get a translator to come into the hospital, like a physical person to translate for patients. And that was a pain in the butt because sometimes they weren't available and you're there with this person that doesn't speak the language and you're having the worst time trying to communicate with them. So now, they have those different computerized things that you can hook up to and get a translator from somewhere else, like anytime you want, and you can talk to them in real time. The translator can talk to the patient and you, and it's just so much easier. But there's still other things that we're lacking in, like, when you go to discharge someone from the hospital and you give them discharge information, there's still not every language out there available to print out their discharge instructions. So if I'm someone who the hospital doesn't have my language, I'm getting discharge instructions in English probably. So there's a lot of things out there that we need to get better on with this. Okay, so this is talking about standardized guidelines and communication practices. So the use of standardized evidence-based care guidelines can reduce disparities in diagnosis and treatments, as well as guide you in your learning and practice. So improving interpersonal skills is an important first step in reducing health disparities and providing culturally competent care. It's important to understand the most effective approach to use with a cultural group. For example, when talking with people from some cultures, it's imperative that you take time to establish trust and to listen to the patient's responses to questions. When meeting a patient or family member, introduce yourself and indicate how you would like to have them address you, whether they should use first names or Mr. or Mrs. or a title such as a nurse. Also ask the patient how he or she prefers to be addressed. This shows respect and will help you begin the relationship in a culturally appropriate manner. When language barriers exist, get the assistance of a qualified medical interpreter. Nurses have a professional and ethical mandate to overcome barriers to provide culturally competent care. Okay, this has a couple of questions here at the end. So it says, Which patient would the nurse determine is at highest risk for untreated hypertension? So we already know that there's, a health disparity among different cultural groups, right? So when we're looking at this, we can look at the different cultural groups in each option here, right? So Asian American, upper middle class female, African American male without health insurance, and then white male who has a high school education. So we know that the more education you have, the better, health access and everything that you have, right? And then also, if you are, pretty well off, like this says upper middle class, so this person's kind of well off, that person isn't going to have a big disparity, right? So who do you think would be at highest risk for untreated hypertension?
C, because he does not have insurance. So.
Yeah. Plus, with African Americans, they tend to have a big issue with high blood pressure. So
Yeah.
that's another thing. All right, how about this one? So which intervention by a nurse would best help to reduce healthcare disparities?
Well, when I think of disparities, I automatically think of the first thing I think of is like culture and stuff and race and stuff. So to fix that, more people of different cultures and races. So C.
Yeah, so C is the correct answer. So if we get more people into healthcare professions from those different cultures, that's going to be better because you can relate better. Like if I'm a minority person from that particular culture and I come to the hospital, if I have another person from my culture there, I'm going to relate better and trust them more compared to someone else, right? And so maybe they would be more apt to come to the hospital because they have that, All right. So anyway, that was chapter 2 from our big book. So that is part of what you guys would have looked at and realized it this week. So I have those key points from the different chapters from this week. So I'll see if I can just email those to you guys. And that way you have those too that you want to, if you want to look at those, for help with the content. Okay.
Okay.
Okay, guys. So this is my plan. We need to meet for lab. I think our lab
Professor
starts.
Silk, we can't hear you.
Can you hear me now?
Yeah.
Okay. All right. So we need to meet for lab. I think lab's supposed to start at 12:30 or something. We
Yeah.
could start it at 1 if you want. That's fine. Is that okay with people to do it at 1?
Can we just do it like sooner instead of waiting? I mean, it doesn't matter, but I'd rather just get it done with.
So you want to meet at 12:30? Is that what you're telling me?
Yeah, that's fine, honestly.
Okay. All right. So we'll come back on here at 12:30. Let's just keep the same Zoom. That way we're not getting 3 million different invitations out there. We'll just keep the same one. So in there, I just want to make sure that everyone can get in okay, because there's a couple people I see who still have not got in there. So we'll talk about that. I'll just talk a little bit about some basic stuff, and we won't spend forever in there together. We'll just spend a little bit together.
Sorry, when you say in there, what do you mean? I'm lost.
We
In
have to
there.
meet. We have to meet for lab.
Yeah, on here on Zoom.
Yeah, that's what I'm talking about.
I think she mean like people who are like logged into, who got all their access codes and stuff in and stuff like that.
Oh,
Is that what
okay.
you?
Yeah, I'm just saying I'm not going to spend like an hour or two on here with you when we come back on. I'll make it, as small of a period of time as I can. Okay. So my plan is then we'll get in there. We'll talk about, how to get in if you haven't done it yet, to make sure everyone's good with the content. We'll, go over that. And then we need to do some math. So that's where I plan on doing it at, in lab. So we'll do our practice math test together, and we'll go over that to see if there's anything on there that you don't feel real comfortable with. So you guys get ready for that. So that's my plan. So when you come back on, just make sure you have paper and pencil so you can work some of these math things out. Okay? So 12:30, come back onto this Zoom session. Same one.
All right. Thank you.
All right, thanks.
Bye.